Hi, and welcome to our loss of suction troubleshooting video for our original suction kits. There are a few things that can cause loss of suction, and we're going to work through the most common ones now. First of all, with your pump going on the highest suction level, remove the tubing and place your finger over the holes. If you can feel the suction, the issue is most likely to do with the setup of your kit. Check over the tubing, making sure there are no kinks or damage of any kind. Pop the tubing into the unit and place your finger over the end. You should still be able to feel the suction working. If not, replace your tubing and connectors. Check over your diaphragm cup for any tears and then place it into the body, ensuring that it is sitting flat. Grab your cap, push it down and twist firmly into place. It should not be loose. Take your valve and ensure the membrane is sitting flat on the body. You may need to gently remove it to check over for any tears and damage, and wash it in warm soapy water to remove any milky buildup or oily residue that may prevent it from sitting flush. These components work together to create your suction. Sizing is really important. If your kit is too large or too small, you may not be experiencing the correct level of suction. Use the sizing guide provided with your pump to measure your nipples. Your nipples should take up the entire gap or have a maximum space of 2 mm around. If your nipples are smaller like this one, we do have insert cushions available to purchase to make the tunnel smaller and provide that all-important compression. As our parts are made from food-grade silicone, they will need replacing over time. Making sure that you're replacing parts when required will ensure you are getting the most out of your pump. We hope this helps, but if you are still having issues or would like some further support, please get in touch with one of our friendly and experienced team. Thanks.